Hello, today we're interviewing Dr. Michael McDermott, who is an associate professor here at UL. Dr. McDermott, tell us a bit about your education.
So I started my undergraduate education at the University of Maryland. When I finished work there, I started doing research with a large research group that was based out of the University of Maryland. So I graduated and then I worked full time, basically as a research assistant for a larger research group. I worked closely with two researchers as part of this group. One was Matthew Tull and another one is Kim Grotz. And they do research on emotion dysregulation, PTSD, and substance abuse type of work. And they then actually took a position at the University of Mississippi Medical School. So I was there for 1 year working with this larger group, but I was working with them in particular. And they moved to take faculty jobs at the medical center in Jackson, Mississippi. And so I actually moved with them to continue work for a year. So I did 1 year of research at the University of Maryland after I graduated, and then 1 year of research at the University of Mississippi Medical Center with them. And then I sought out graduate training. And because I was in Mississippi at that time, I looked at the University of Mississippi, and they happened to have a faculty that was there that was doing very similar research to what I was hoping to kind of pursue. And so it was really convenient. I was already in the state. And so I then went to the University of Mississippi for graduate school. And that's where I earned my PhD in clinical psychology. While I was there, I worked with a researcher. His name is Todd Smitherman. He does a lot of work with migraine and chronic pain. And so I was able to kind of combine my research interests in emotion dysregulation and health-related behaviors like substance abuse with more physical health-related conditions like chronic pain and things like that. And so that was kind of my specialty and specialization in graduate school. After that, I went to the University of Mississippi Medical Center. I went back to complete my 1 year internship and residency. And then after that, when I applied for faculty positions, I moved here to UL and I've been here since 2015. So I've been here about 6 years.
That's excellent. So 2016 is when you became part of the faculty here.
I think it was 2015. Yeah, 2015.
Okay. And when you're here, what courses do you typically teach?
So the courses that I teach most regularly, I teach a course on substance abuse, so Psych 321. I teach a course on testing and assessment, so that's Psych 442, and I teach those in the spring and in the fall. And then I will usually teach one or both of those courses over the summer as well. I don't know that I'm going to teach a summer course this upcoming cycle, but most of the time I'll teach one of those during the summer. Okay. In terms of kind of other classes, I've taught abnormal a few times, and then once every other year I teach intro to clinical psychology in the fall. So those are most of the undergraduate courses that I teach.
I believe you also manage our assessment clinic.
Yes. So in addition to the courses that I teach, some of my work as a service member to the department and the university is that I oversee and help coordinate and manage our assessment clinic, which provides psychoeducational assessments to students and to the community. And so people who are potentially struggling with things academically, maybe they're struggling with psychological related issues that might be causing difficulties in an academic setting, potentially difficulties with inattention and ADHD. We conduct comprehensive evaluations to kind of determine what somebody might be struggling with, how that might be affecting them. And then we draft up reports and documents that can be used for the Office of Disability Services to provide accommodations, to potentially sort of address some of those issues, but that they can also take with practitioners in the community to provide some additional clarity about the things that they might be struggling. And so we do those. That has a number of graduate students involved in it who are in training to provide assessments. And so it's an opportunity for them to get hands-on, tangible experience providing these comprehensive assessments that are also at a reasonable price, at a considerably reduced price, and accessible to a lot of students and community members.
That's excellent. It's a wonderful service that we offer. And do you not also teach a graduate course in assessment?
So I teach a graduate course in assessment, and I do that once a year, and that's to train graduate students in conducting these evaluations. So psychoeducational assessments, including intellectual assessment, academic achievement, but then also an evaluation of psychological disorders and things like anxiety, depression, ADHD. But then I also teach a graduate course every other year in cognitive and behavioral therapy. So it's a similar type of focus on not necessarily the assessment side, but then what does practice look like? What does treatment from a clinical psych perspective look like when providing evidence-based care?
Okay, that's excellent. I know you also do some research. Is there a framework that guides your research?
So I am a clinical psychologist by training, but my training is in health psychology. So I guess formally I'm a clinical health psychologist, though my degree does not say clinical health psychologist. I think that's the most general kind of training that I have. From that training, a theoretical orientation perspective that I take when examining sort of psychological and health related factors is a behavioral approach. Largely, I take what's considered a contextual behavioral approach. If you guys are familiar, if people are familiar with some of Sandoz's work, I do similar type of work, or have a similar type of theoretical perspective that she does. It doesn't mean that I do a lot of the acceptance and commitment type of things that she does, but I have a general similar theoretical orientation. And what that means is that I examine psychological constructs and health-related constructs from a very behavioral framework. So how is the environment sort of shaping behaviors? But then I also understand this from a contextual perspective, meaning that the environment can shape behaviors, but that's particular to setting, context, environment, and situations. There's also kind of a component of our evaluation of that, so from our lens. How do we appraise those experiences? Much of my work focuses on the overlap between psychological factors and physical health. So how do psychological factors directly impact physical health? How do physical health conditions or improvements in physical health directly affect psychological health? And then I'm particularly interested in what are some common factors that help us understand how these sort of separate disciplines and separate areas of health might be related. So we know that they're related. How are they related? How might factors like emotion dysregulation, which is a way that we approach the experience of emotions. So not am I experiencing a distressing emotion, but am I experiencing difficulties with appropriately managing that unpleasant or difficult emotion, and how that might help clarify how and why psychological factors might be affected by physical health and vice versa. So that's kind of some of my general research areas.
Okay. And so what about, are there any particular studies you would like to describe for us today?
We have a number of studies going on right now, or we just concluded examining, like I said, that relation. One series of studies that we have is examining how emotional distress might affect pain conditions or the experience of pain, and how emotion dysregulation kind of might help clarify that relationship. And so we know that if somebody experiences a pain condition, chronic pain, migraine, something like that, that might increase likelihood for emotional distress, anxiety, sadness. And that we also know that anxiety, sadness, negative affect psychologically can then impact pain conditions, and the two tend to be kind of bidirectional and reciprocal. And so we have a series of studies trying to sort of kind of elucidate how does emotion dysregulation or this dysregulated emotional functioning kind of play into that relationship. And so several studies we have going on, we actually kind of ask people to experience a little bit of pain, not pain that causes any tissue damage, but pain that might kind of be unpleasant. We do this in a number of different ways. One way is we ask people to kind of dunk their hand in 3 degrees Celsius ice water. And that's not very painful if you're in there for 5 seconds, but if anybody's ever put their hand at the bottom of an ice chest trying to grab a soda or something like that, and they're kind of in there for a while, it can become a little bit distressing and painful. And so we do different studies where we elicit a little bit of pain to examine kind of how people respond when they're experiencing those kind of pain conditions. We have another series of studies where instead of looking at poor psychological health and poor physical health or conditions in terms of like pain and things like that, we've actually kind of reversed things where we're looking at how benefits or improvements in physical health could impact psychological health. So we have a few studies where we ask people to engage in exercise, and we measure various aspects of physiological functioning, heart rate, variability in heart rate, responding in terms of emotional distress and things like that. So we look at things like cortisol production, which is a marker of physiological arousal, usually associated with like emotional distress, things like that. And so we have people exercising, and then we ask them to do distressing tasks and things like that, to see if maybe exercise might play a role in how well people might manage distressing experiences. So those are kind of the 2 types of different studies that we have going on right now. Those aren't necessarily the specific studies or aims, but those are kind of the areas of work that we've been doing in our research lab.
Mm-hmm. And your lab is called the Heat Lab. What does that mean?
Yeah, it's a fun acronym, and it's a little bit redundant in some of the terms, but we liked it because it was a nice, kind of acronym for HEAT. So it's the Health, Emotion, Anxiety, and Trauma related research lab. To clarify that we're health oriented, physical health oriented, but that we're also interested in looking at those psychological factors that might play a role. So like emotion and emotional responding, and then within that, anxiety and trauma are 2 areas that we focus in our work.
And if someone wanted to join your lab, how might they do that?
The most efficient way is to send me an email, and then I'll either respond with like a time that might be good for us to meet, or I might ask our graduate lab coordinator to kind of reach out and meet with you in person, to kind of see about your interests, and then we can kind of just go from there. The lab is pretty open in terms of potential interests. We tend to have sort of a 2-tiered approach, where if somebody's interested in seeing what we're doing and getting, a little bit of an overview of what kind of research we do, for the most part, most people are welcome to come and join, to audit and kind of, see the different studies we have going on, to participate in our meetings, and to just be generally involved. And if that's something that's of interest to you, if the lab is a good fit, then we usually have a second kind of follow-up discussion about what formal involvement in the lab means, what that would look like for the student's commitment, and what that would look like for my commitment to the student. And that's a little bit more of a formal kind of process, not formal in terms of not taking tests or anything like that, but a little bit more formal in kind of the expectations. So the nice thing is that, if somebody's interested in seeing what we do, they don't have to jump into that more formal commitment. They could just come in and see what we're doing. And if it's not a good fit, then they just let us know it's not a good fit. And they can kind of pursue something else.
So they should contact you as the first step.
Yeah, just contact me, reach out. It's the easiest way. I'm pretty readily available by email, so.
Excellent. Anything else you'd like to tell us about today?
No, I think that covers most of the types of things that we do.
Excellent. Well, thank you so much for talking to us.
Thank you very much. Appreciate it.